Thank you for taking the time to be here and partner with the Department of Homeland Security to help keep our children safe. My name is Bill Braniff, and I'm the director for the Center for Prevention Programs and Partnerships at DHS. Now, you may expect that the Department of Homeland Security would invest in resources and partnerships to help protect our schools through physical security measures, or to investigate and disrupt active threats as they're mobilizing to violence, right? Those are the roles that we traditionally expect from our homeland and national security apparatus. But the Department of Homeland Security also invests in a third leg of the risk reduction stool, and that is prevention, upstream prevention. And that's the work that I run for the department. You might be surprised to know that we've adopted a public health informed approach to targeted violence and terrorism prevention at DHS. We've learned from the Centers for Disease Control, which since the mid-1980s has been looking at violence as a public health issue and then trying to identify how to decrease the likelihood of violent outcomes for a host of different forms of violence: suicide, intimate partner violence, community-based violence, violence towards children. Right? These are areas where they've invested significant resources, conducted a lot of program evaluation of different violence prevention programs, and have started to develop technical packages that go out to partners to build violence prevention capacity to address those forms of violence. While at the department, we're basically modeling ourselves after the Centers for Disease Control, but we're looking at targeted violence and terrorism prevention specifically. Why is it important for us to invest in this upstream prevention? Well, unfortunately, there's a few reasons. One reason is the volume challenge. There's been about a 2,000% increase in the number of mass casualty attacks in the United States since the early 1990s. And these forms of violence vary. They are inclusive of terrorism, whether that's international or domestic terrorism. They're inclusive of premeditated hate crimes. They're also inclusive of individual grievance-based violence, like school shootings or workplace violence. And so because there's a large increase in the volume of mass casualty violence and it takes on different forms, we need to adopt an approach that works upstream before any of that violence manifests, no matter which form it might manifest in. And so the public health informed approach allows us to look upstream and really ward off all of those negative outcomes. What is the public health informed approach? In general, the public health informed approach is a multi-level approach that looks at building the protective factors or the characteristics at the individual, the peer, the family, or the community level that decrease the likelihood of violent outcomes in the future, while also identifying risk factors that increase the likelihood of violent outcomes and figuring out how to mitigate those. The public health informed approach can involve upstream prevention at the community level. We call this primary prevention, where you literally build on the strengths of a community to crowd out vulnerabilities on the margins. One of the ways we do this at the Center for Prevention Programs and Partnerships is by investing in the Invent to Prevent program. We give students a semester to build locally tailored programs in their school, both at the high school and collegiate level. And they often take a strengths-based approach, building on protective factors that they know will make the culture of that school less conducive for violence and more conducive for violence prevention. So I'll give you an example. The winning team last semester looked at social isolation as a risk factor for negative health outcomes, including violent outcomes, and bullying. And they created a strengths-based program based on mentorship, where seniors were incentivized to mentor freshmen. These freshmen were emerging from several years of the pandemic. They were at greater risk of social isolation. They may have been at greater risk of bullying. But by changing the culture in that school to incentivize the upperclassmen to mentor and embrace these students, bring them, engage them in social inclusion, instead, you're warding off potential negative outcomes, including violence down the road. Straightforward, low cost, positive programming, but that really has an impact at decreasing the likelihood of violence. We know that's not going to work in every case, however. And so public health informed approaches also involve secondary prevention, a safety net. Secondary prevention programs include things like behavioral threat assessment and management teams, coupled with referral networks. This is something that we invest in heavily through the Center for Prevention Programs and Partnerships, our grant program, as well as our field staff around the country who help bring training to school systems to create these programs and improve them over time. So a behavioral threat assessment and management team is a multidisciplinary team. It may involve school administrators, behavioral health specialists, social workers, mental health specialists, as well as law enforcement who take on cases when someone is exhibiting behavioral indicators associated with targeted violence or terrorism. One thing we know from the data is that perpetrators of these kinds of violent acts leak their intention. They ideate about violence in a general way before they actually engage in the violence in the majority of cases. So NTAC Secret Service is going to tell you that over 80% of school shooters have leaked their intention to engage in violence before that violence occurs. And we see this in other forms of violence as well, whether that's mass casualty violence, individuals joining overseas conflicts. Humans tend to leak this intent. That violent ideation is a behavioral indicator, and it gives us an opportunity before that person is engaged in a crime to conduct an intervention and identify what direct service providers can actually help build the protective factors in that person's life and decrease risk factors so that we can decrease the likelihood of violence. And we're partnering with school systems around the country to create these non-criminal justice interventions, these alternatives to investigation. While protecting the civil rights, civil liberties, and privacy of these students, we're able to increase public safety for their classmates and for themselves. These programs are really pragmatic. They show incredible promise, and we are eager to help couple schools with direct service providers and create these intervention teams. One of the second order benefits, of course, is that by offering up a non-criminal justice alternative or intervention, we're able to help decrease bystander hesitancy. You can imagine that friends, teachers would be very hesitant may be very hesitant to call law enforcement if they are concerned about an individual, but they haven't seen something that suggests an imminent and likely threat to their classroom. Hotlines, often anonymous hotlines, create these referral opportunities to get somebody who you're just concerned about some help before violence ever manifests as an attractive option for that person. I'd like to just leave you with a few resources should any of this prevention work be of interest. Of course, the Targeted Violence and Terrorism Prevention Grants Program that CP3 runs is available to you. We also have a new addition to the website, dhs.gov/TVTP grants. There's a tab on the left-hand side of the screen for grantee results. So if you're interested in seeing how other grantees over the years have produced violence prevention programs and learning from those efforts, look at the grantee results webpage at the TVTP Grants Program website. We've also helped to curate a resource from 17 different interagency partners. We call it the Prevention Resource Finder, which is available at dhs.gov/prevention. The Prevention Resource Finder has almost 100 products in it that are intended to help get resources to organizations like yours to help build prevention capacity. So everything from grant programs to training programs to toolkits available through the PRF. And then finally, I'd encourage you to look at the Invent to Prevent program at the McCain Institute's website. Invent to Prevent is a program that we've run nationally at the high school and collegiate levels. And it's really one of the, I think, most proactive ways we can help build cultures of nonviolence and violence prevention in our schools, which of course is the goal. Thank you.